Doctor, please help me. They have put a packing in my nose, and I truly do not know what to do with it. How long it will actually stay in there. What specific actions I should take, or really anything at all about this situation. Okay, first, when do we put packing in the nose? We put packing in the nose if we have bleeding, and the bleeding is so much that we can't stop it with cauterization or deal with it locally, if there's a large area that's bleeding a lot, then we put packing in to put pressure on the blood, and also after surgeries. So for someone who has had a septoplasty or any kind of nasal surgery for various reasons, they usually need to have this packing placed. That's the first piece of information. The second thing I want to tell you is that there are two types of nasal packing. One type is removed, like gauze with Vaseline or something called ProHealthConsults. It's like a sponge that goes in, applies pressure inside, and stops the bleeding. This type of packing is removed, but there are other types that are not removed. That means it's left inside and gets absorbed by the body on its own. And this type causes far fewer problems than the ones we remove. The ones we remove are a bit unpleasant and make the patient uncomfortable, as I mentioned. Now, I'll answer the questions that this patient asked me. The first thing she asked was, how long will this packing stay in? We usually leave this packing in for 48 hours, meaning 2 days. It doesn't stay for more than 5 days. So we never leave anything in the nose for more than 5 days. It's always between 2 to 5 days. Who decides that? The doctor who put it in? Okay, will I feel uncomfortable while this packing is in? Yes, of course. The whole idea behind this packing is that by applying pressure, it prevents bleeding. And so when we put packing in both sides, it means the nose is completely blocked. And when the nose is blocked, first of all, you'll feel pain. Secondly, you'll experience headaches. Thirdly, there will also be tearing. There will be constant tearing from the eyes. Because normally, tears are drained through the nose, actually through the nostrils. So when we block the nostrils, the tears accumulate, leading to increased tearing from the eyes. Also, a person can't sleep well because they can't breathe through their nose, so they keep their mouth open. There's no sense of smell because the nose is blocked, and as a result, they can't smell food, so it has no taste. Also, keeping the mouth open all the time for a day, 2 or 3 makes our throat hurt and makes us feel uncomfortable. Okay, is it possible for me to bleed even with this packing in place? Yes, of course. If the packing is there, but it's not pressing or not reaching the spot where we need to apply pressure to stop the bleeding, you will bleed. If the amount of blood is so much that the pressure we're applying with the packing isn't enough, there will still be bleeding. So what should we do if bleeding occurs while the packing is in place? We press on the nose from the outside like this. We press firmly on this area and keep pressing for 5 to 10 minutes, and we don't call the doctor yet. No, we go to the hospital or emergency room to see what needs to be done. That's it. But keep in mind, when I press like this on the packing that's inside the nose, a little bit of blood might come out. That's not what I mean by bleeding while the packing is in place, is it? No, by bleeding I mean a lot of blood comes out from the front without me touching it, without me squeezing it like this, or it goes down my throat from the back and I swallow it and, spit out blood. That's it. So that's what could happen even while the packing is still in place. Okay, so if that's the case, why don't we just leave it in for a longer period? Why not remove it after 2 days or after 3 or even after 5? Why not leave it in even longer than that? No, that's not possible. We can't leave it in because it's a foreign object, and foreign objects can cause complications. So what are the complications that can happen? The first thing is infection. Any foreign object inside our body is susceptible. Bacteria can grow on it and might start to get inflammation, which we try to overcome by taking antibiotics. Yes, but even antibiotics themselves can cause problems because they can cause allergies, they can cause stomach pain and things like that. That's why we don't like to leave it in for too long. Other than that, what complications can I get from the packing? The pressure itself, the packing presses against the inside of the nose to stop the bleeding, can reduce the blood flow to areas like the nasal septum. As a result, a hole can form in the nasal septum, or other complications can occur, like adhesions inside the nose itself. These adhesions can make your nose feel blocked or uncomfortable even after we remove the packing. Also, of course, we can't sleep well because our nose is completely blocked. So sleeping becomes difficult and uncomfortable for me. So to reduce these complications, to minimize the risk of infections, we take antibiotics. While the packing is in place, we stay on antibiotics. Another thing we can do is keep the nose moist, especially for the packing itself. When it's Merocel or that sponge, we can use saline solution for this. Yes, using a syringe or an injector, we apply some saline to prevent it from drying out, so it will be easier to remove and won't cause many complications. So doctor, what am I not allowed to do while I have this packing in my nose? You shouldn't exert yourself too much or get upset. You shouldn't lift heavy things. You shouldn't play sports. You shouldn't bend forward too much, like picking things up from the floor or making a big effort. When you're lying down, keep your head elevated. Don't take too many painkillers, especially anything other than paracetamol, like Panadol or other simple medications. Stronger painkillers actually thin the blood, which can cause the bleeding to happen again. Is walking forbidden? No. Walk normally, but also as long as walking doesn't tire you out and the weather is good, not dusty or anything like that, so the filling doesn't catch an infection from sneezing. Ever since I put this packing in my nostril, I feel like I want to sneeze. When you need to sneeze, sneeze with your mouth open so you don't dislodge the packing or put pressure that could cause more bleeding. Okay, the most important question now, what should I feel while the packing is in that would make me go consult the doctor, return to him, or call him? Yes, the first thing is if you notice bleeding, as we said, you should press on the nose from the outside as we mentioned to stop the bleeding, but you might need to visit the doctor. The second thing is if your temperature rises to 38.5 degrees or higher, then you should consult the doctor. If you feel the pain is increasing and it's not normal, not like when the packing was first put in. If the pain we're feeling keeps increasing, what should we do right away? We should consult the doctor if we notice any problems with vision or if the color of the skin around the nose changes. It could be pressure reducing the blood flow to the area, or it could be a skin rash from the antibiotics or something else, like spots appearing on the skin. In these cases, we should consult the doctor immediately. And if we notice swelling in the face or around the eyes, we should go back to the doctor as well. Okay, so finally, if I remove this packing, what could happen? I mean, what will I feel? When we remove the packing, there is always some pain, of course, because it tends to stick a bit inside the nose. So when it's pulled out, there will be some pain. It's also possible that more blood might come out and there could be some bleeding again when we remove it, but that doesn't mean we'll need to put in another one or anything like that. No, we just wait a little, examine the nose, and make sure everything is fine. The small amount of blood that comes out usually stops after we remove the packing, God willing. Wishing you a speedy recovery. If you like these videos, subscribe to the channel so we know you're waiting for more, and give the video a like. Wishing you a speedy recovery.